Hello, you're tuned into daily coronavirus updates. Today is the 20th of April and this is The Wire.
17,265 people have been infected by the novel coronavirus in India so far. 2,547 people have been cured. Maharashtra continues to remain the worst hit. The state has recorded a total of 4,203 infections, followed by Delhi, which has recorded over 2,000 infections and 45 fatalities, including the death of a 1.5-month-old baby. The number of infections in Uttar Pradesh have gone up to 1,084. Kerala, which was one of the states with the highest number of infections, has managed to flatten the curve, and the number of infections in the state have gone down to 402. Sikkim is the only state with no coronavirus case in India so far and has partially lifted the lockdown today. On Monday morning, India recorded the biggest single-day spike in the number of cases. 1,553 people reportedly contracted the virus in a single day. The Ministry of Health and the ICMR in their daily press briefing said that of the 100 people tested positive with the infection, 80 patients don't have any symptoms, which means they showed no signs of fever, cold or cough, yet tested positive for the coronavirus. The ministry also said that before the lockdown, the number of infections in India doubled within 3.4 days, but after the lockdown, doubling of cases has come down to 7.5 days, which means the rate at which the number of cases is increasing in India has slowed down. Lockdown restrictions in some parts of the country were lifted today, including the movement of migrant labour between districts by buses. On the other hand, the governments of Delhi, Karnataka and Punjab said that there will be no relaxations until the nationwide lockdown ends on the 3rd of May. The Telangana government has also extended the complete lockdown in its state till the 7th of May. The UP government has allowed 11 industries to commence operations subject to conditions. A newborn has tested positive for coronavirus in Rajasthan's Nagaur district. The child was born on Saturday and her mother, father and other family members are COVID-19 patients too. The pregnant mother was admitted at the Basni Primary Healthcare Center in Nagaur. 59 people in that area have tested positive for the coronavirus so far. At least 54 people were arrested on Monday for allegedly trying to clear the barricades which were put up by Bengaluru municipality to contain the spread of the coronavirus. According to reports, this happened when civic body officials along with ASHA workers arrived there on Sunday to take 58 secondary contacts of a diseased COVID-19 patient into government quarantine center. Bandipora district in Kashmir is a hotspot district and health authorities in Bandipora have been struggling to prevent the spread of the coronavirus. Bandipora has a population of around 3 lakh and the district has reported 80 coronavirus cases in the last 10 days. Of the 80 cases from the district, around 40 patients, including 11 family members, are from a single village with a population of less than 3,500. The authorities fear that the village and its surrounding areas are witnessing community transmission. According to a report published in The Wire Science by Mudassir Ahmed, what is making matters worse for local administration is poor medical staff, low rate of testing, and lack of protective gear for doctors. Despite a large number of cases, less than 200 samples have been taken from the village so far. A doctor told The Wire's reporter that more than 95% cases that tested positive in the village were asymptomatic. A report published in the Washington Post has revealed that the Trump administration got real-time information about the discovery of COVID-19 and its spread in China from healthcare workers, some from the Center of Disease Control and Prevention who were working full-time at the Geneva headquarters of the WHO. The Washington Post has learnt that Trump-appointed senior health officials were consulted regularly at the highest levels with the WHO as the crisis unfolded. This undercuts President Trump's assertion that the WHO's failure to communicate the extent of the threat is the reason for the spread of the disease in the United States. This comes days after the President of the United States halted its funding to the WHO, accusing it for inaction with regard to the spread of the coronavirus. First COVID-19 autopsy report from one of the top US hospitals, the Cleveland Clinic, highlights the importance of the fact that a person can die from a condition removed from COVID-19, which means the virus can be a bystander. The first report of the patient who died from the virus was an obese 77-year-old hypertensive man, whose autopsy showed that the lung sacs were smeared with a substance that resembled thick paint. The man was confirmed to be positive by PCR testing. He had been symptomatic for 6 days and had fever and chills. He died before he could be put on ventilator. The second case was a man who was infected by COVID-19 but did not die from it. The 42-year-old man died of bacterial pneumonia. He was admitted in critical condition for fever, cough, and chills. A CT scan done before he died revealed ground glass opacities in both lungs. His nasal swabs tested positive for the virus, but lung swabs tested negative. The final autopsy listed COVID-19 as a condition, but not the cause. The authors noted that the patient likely died from COVID-19, but not from COVID-19. To learn more about this story, you can log on to The Wire Science.
That's all for today. Keep reading The Wire and The Wire Science. We will see you tomorrow. Until then, stay safe.